If you are over 60, common gut health habits may be more dangerous than they look.
I'm Dr. Eleanor Hart. Let me tell you about Carol. Carol said her stomach had become unpredictable. Some days she felt bloated by noon. Other days she was constipated, tired, and afraid to eat. She thought it was just part of getting older. As a doctor, I've seen many gut problems worsen due to small daily mistakes. And after 60, the gut often becomes more sensitive.
Nose. That means the wrong routine can quietly create a much bigger problem.
Stay with me, because one of these mistakes is sold as healthy all the time. Mistake number 1, not drinking enough water.
A lot of older adults drink less on purpose.
They do it to avoid bathroom trips, leakage, or getting up at night.
The colon needs fluid to move stool normally.
Without enough water, constipation becomes much more likely. That can lead to uncomfortable bloating, straining, and hemorrhoids. Her gut also felt slow every single day. Carol was drinking coffee, but not enough water. Her body felt the profound difference lack of hydration makes. Mistake number 2, eating too little fiber or adding too much too fast.
Or felt. Many older adults do not eat enough fiber.
Then they try to fix everything with bran cereal, powders, or giant salads.
That can backfire. If fiber goes up too fast, bloating and gas get worse. The gut usually does better with gradual change. Steady fiber, enough water, not a panic move. Carol tried to eat cleaner in one weekend. Instead of feeling better, she felt swollen and uncomfortable for days. Mistake number 3, relying on laxatives without asking why constipation started. Constipation is common after 60, but common does not mean harmless.
Some people use over-the-counter products repeatedly without understanding the cause.
Sometimes it is low fluid, sometimes low movement, sometimes medication is the cause.
But sometimes it is something more serious.
Furs of our red rivals arrive.
Digestive aids may help in the right situation.
But if constipation is new, worsening, or constant, that deserves attention.
Carol kept treating symptoms. She never asked why her bowel habits had changed.
Mistake number 4, taking antibiotics or acid reducers casually, ignoring gut effects. Some medications can disrupt the balance of the gut.
Antibiotics can do that. Acid-reducing medications may also affect digestion over time. that does not mean these medicines are bad.
It means they should be used carefully and reviewed when symptoms change.
Säkert förstås. Never stop a prescribed medication on your own. But do ask whether it could be affecting your digestion.
In Carol's case, the timing mattered. Her gut problems worsened after antibiotics.
This typical list for milk. Let me say something many people need to hear right now.
Not every gut problem truly needs a detox. And not every bloated stomach needs a trendy supplement.
Often, the real solution is simpler than you think.
A weak routine creates many gut problems. And a foolish shortcut can make them worse.
Mistake number 5, ignoring movement. The gut likes motion.
And when the body becomes more sedentary, the bowel often slows down too.
You do not need punishing exercise. But regular movement helps stimulate normal digestion.
Even light walking after meals can help.
For Carol, this small change mattered more than she expected.
Mistake number 6. Eating too fast, too late, or under stress.
After 60, the digestive system may become less forgiving.
Late heavy meals, rushed eating, and stress can irritate the gut for hours.
Reflux, gas, bloating, poor sleep, and a stomach that never feels settled can result.
Healthy food still causes trouble when the habit around it is chaotic.
Slower meals, less pressure, earlier dinner. These changes sound simple but are often powerful.
Mistake number 7, treating every gut symptom like normal aging. This is the most dangerous mistake of all, because it delays action. Yes, digestion changes with age, but persistent symptoms should not be brushed off. Constipation, ongoing diarrhea, pain, blood in the stool, or worsening reflux require attention.
Unexplained weight loss or sudden appetite change should also never be ignored.
Open communication is always beneficial.
Auspidet media ustada jatake. Yeda jodi non tembe sesilu paituni. Abian kra joswa to razu to binnik.
So what should you do instead? Let's look at some simple steps.
Start with the basics. Drink more water during the day.
Increase fiber slowly. And move a little after meals.
Chew slowly. Avoid eating heavy meals too late at night.
Review medications with your clinician or pharmacist if symptoms changed after new ones. Also track your pattern. Write down what you eat and when symptoms happen.
That simple record can reveal a lot. Now let me give you the red flag warning.
Seek medical care quickly for blood in stool, black stools, or severe abdominal pain.
Repeated vomiting, fever, or new trouble swallowing also require quick attention. Unexplained weight loss or constipation that becomes severe or sudden are also serious.
Those are not problems to explain away.
If diarrhea lasts days with weakness or dehydration, that needs attention.
Older adults can become dehydrated faster than they realize.
When Carol stopped quick fixes and started fixing the basics, her gut began to settle. Not instantly, but steadily, she felt less bloated.
More comfortable. Less afraid of her own meals. If you are over 60, gut trouble is not shameful. It's important to approach this with attention.
Tell me in the comments, which gut health mistake do you see most often?
Want clear, practical senior health advice without nonsense? Subscribe to Oakwell. Sometimes the smallest daily habit is the one quietly hurting you most.